Hello, my name is Benjamin Oliver. This video is on the Yi Chuan Meditation system as an aid to those suffering from COVID and specifically long COVID, featuring Master Quinones and Dr Santoro. The Yi Chuan system was developed in China by Grandmaster Wang Sangcai. The system consists of corresponding postures and visualizations. Later, Master Yi Dong comes to New York City and starts teaching in New York. That's when Master Quinones meets Master Don. They trained obviously in New York, but also in Shanghai, Chengdu and Beijing. Later still, Master Don awards Master Quinones the lineage of the system. This was approved by Grandmaster Wang Sangcai's daughter, Madame Wang Yifeng, in Beijing. I also need to point out something is there's many branches to the Yi Chuan tree. This is only with reference to this one branch leading from Grandmaster Wang Sangcai to Master Quinones. COVID and Yi Chuan. Master Quinones has been working using his knowledge of the system to help people to recover from the effects of long COVID. This is a process that's still underway and there'll be more of this to follow. What we will see now is a conversation between Dr Santoro and Master Quinones. Now, Dr Santoro is obviously a medic. He's also the patient. He got COVID, and he's also a martial artist. So we have multiple viewpoints, which makes this more interesting. After that, we will then see the Yi Chuan meditation with some of the movements and both the standing portion and the seated portion. And lastly, we'll see Master Quinones working with Dr Santoro on a walking technique to establish integrity and strength in his left leg. And just watch the difference from the first pass to the third and the fourth pass. It's incredible to see. Lastly, I'd like to point out that this video has been shot in the space in which we train, which is on the edge of Chinatown in New York City. Therefore, in the background, you will hear the sound of disgruntled drivers wishing they weren't where they are right now. Thank you.
Well, I want to thank everyone for tuning in. My name is Master Quinones, and I'm the master of the system of Yi Chuan, system that I studied with my great teacher, Master Yi Dong. With me today, I have Mr. Michael Santoro, who has been involved with the medical field for many years, and also one of my old students, and also my Gunfu brother. My background goes back to 1963, when which I came into the martial arts, and then greatly exposed to the system of Yi Chuan. It's a great honor to have Michael here. Thank you.
My honor, Sifu.
So Mike is here to explain, to offer to us what happened to him when this virus kicked in while he was working in the hospital. So Mike, can you please tell us?
Sure, I was working in the hospital. I'm a doctor of physical therapy and a pulmonary rehab specialist. And I was evaluating pulmonary patients with COVID. And it wasn't long after that, in the first wave, that I got sick myself. I was admitted to Greenwich Hospital and I suffered a stroke while being treated there. I went to Burke Rehab and was treated there for 6 weeks, and on inpatient and outpatient basis. And now that's my history with COVID, and still in the process of rehabbing now.
Yeah. I want to go back a little bit for the audience and those that will get an opportunity to look at this. And our purpose, which I should have stated right from the beginning, is to offer some of the background of Mr. Santoro and also what he's been doing in terms of his own rehab with the hospital, and also incorporating this type of standing meditation that I have been doing for many years, and he has brought into his own way of incorporating it to his recovery. So I want to go back to when the virus hit. And you first began to see it in your own place of employment, and also you had mentioned earlier about what was going on with people of your staff. How did that come about? How were you, what was happening at that time?
It started off with a few people getting sick. There was a nurse that got sick, and the whole door was covered with posters, do not enter, do not enter. Of course, we have to enter if we're assigned to her. I remember texting my wife, we have one here, like it was a big thing. Within a week, we had 30 COVID patients. Within 3 weeks, I had 30 COVID patients myself that I had to evaluate each day. They moved me to the airway team because I'm a pulmonary rehab and a respiratory therapist licensed. And we were intubating 10 patients a day. It wasn't long after I did, maybe 3 days on the airway team, and then I got COVID myself. And
Now, Michael is also an instructor in the martial arts. His background is also, he has been studying for many years and also studied and graduated from Harvard University. So he has an extensive background both on the martial arts and in the medical field, and with a tremendous degree. So you've been dealing head on with this virus. Now, you had mentioned earlier before we even started taking in this video, how were you treating them? What were you doing in terms of dealing with the patients that were coming in? You say you got 30 patients, and what was going on?
it was confusing because you saw things that didn't fit the norm. You saw people with hypoxemia, which is low oxygen in the blood, but they weren't breathing rapidly. They weren't struggling for air. But if you took their blood sample, which I had to do, you would see that the oxygen was very low, critically low. And they called it happy hypoxemia at that time.
Which means what?
That means they're functioning at a level that seems normal. They don't have a rapid respiratory rate, and they don't have high CO2 levels, but their oxygen is low. So they're functioning, they look fine, their lips are not blue, but they're in bad shape. That was a new paradigm shift for everybody. As a respiratory therapist, it was a new paradigm shift for me. I mean, what do you do with someone like that? Do you just give them oxygen, or do you put them on the vent?
And we're talking back around what, March?
Oh, March, yeah. The first
2020?
wave, yeah. I was seeing patients in January who were showing signs that were out of the normal, were showing signs of this happy hypoxemia. And they were winding up on the vent, and they were kind of young, 40 years old, they got pneumonia. They usually don't go on a vent. These people were winding up on the vent.
You also have mentioned that there was a gentleman that also worked in the hospital with you, right? Who
Yes.
came from, was it from Africa?
Yeah, he was from Nigeria.
From Nigeria?
In shape, marathon runner.
Tremendous.
And he was dead within 3 days of getting
Wow.
that.
No signs of anything. Just
He had a headache.
unbelievable. So, how long was it that you came down with it?
I got it the end of March, was hospitalized the end of March. And I had double lobe pneumonia in both my lungs. I had no idea. I felt a little tired. My pulse ox that measure your oxygen in the normal range. But it was good timing because when I went to the hospital, they gave me oxygen. They gave me oxygen to go with at home. And I worked my way through it.
Right. Was it at any time that you just felt that there was just no coming back from this?
When I felt this fire in my chest, and I thought, my heart, if this affects my heart, I felt a sharp pain in my heart. If this affects my heart, this is not going to be good.
How was your wife handling this?
She was crying a lot, you know. She was upset. She thought I was going to die, you know, and she actually had to get all the paperwork ready. And she had a friend who was a doctor, and he talked to me. Then he talked back with her, and he said, I mean, you got to get prepared for the worst.
So she's been a great support.
Yeah, she's been wonderful.
Incredible.
She didn't get it,
Yeah.
which is surprising because I had it quite bad,
Right.
you know.
So you were home for what time, from what period to what period in terms of from the time you caught it to the time that, was it like 5 weeks, 6 weeks? What would you say?
More than that, I think 2 months, 2 to 3 months, I was out of work.
Wow. And it just progressively got worse.
Yeah, it got worse. I put the oxygen on. You know, I didn't want to go back to the hospital because I didn't want to be intubated, you know. So what I was doing was looking at the Italian studies, what was going on in Italy. It happened there first. And they were saying the ventilators were killing 80% of the people. So I was like, I'm not going to the hospital with a low oxygen level. I got the oxygen here. I had the big tanks. And I took care of myself. I know a little bit about pulmonary rehab. I'm certified in it. I knew the breathing exercise to do. I knew to lay on my stomach. I was doing everything I could possibly do to avoid going back to the hospital.
Right. Because you felt that that would be, it would be it.
That would be it. I thought I kicked it. People were congratulating me. You did well. Then 8 months later, I started getting blood clots. My foot fell asleep while I was walking. Went to the emergency room. They took a CAT scan on my spine. They said, oh, you have a herniated disc, but you also have a little blood clot near your spine. Went home, fell down, went back to the emergency room. I said, I need a CAT scan of my brain because I asked my wife, did I work today? And she thought that was strange that I didn't know. And when they did the CAT scan of my brain, they found a blood clot on the right side of my brain and the brainstem.
And the leg being numb was on the left side.
Yes.
They found the stem. They found the blood clot on your
Yes.
brain. At that time, what are the symptoms you were experiencing?
Weakness on my left side. Spatial problems. I couldn't walk, first of all. I couldn't walk 5 feet ahead without falling to the right. I would walk 5 feet and then fall into the wall. I made sure I was near the wall when I was walking. And, or I'd be out of bed, walk 5 feet, and I always fell to the right. My left side was weak, but I fell to the right. That's one. I had no strength in this leg. I shouldn't say no. 2 out of 5, we call it. You can just get it up, and if someone does this, it will go right down. Cognitively, I had some issues. I couldn't recognize my wife's face. I think that's the time she was most emotional, was when I didn't know who she was when she came in the room. And she started crying. Said, you don't know who I am.
And this went on, was it continuously through the day or was it on and off throughout?
No, I went through continuously through the day. When I came up with an exercise, and this is interesting, to remember faces.
What was that?
Like, I had a problem putting a face to a name, you know? And I used family members, my wife's family first. And I could not, all right, my father-in-law. It's interesting, the face would be like a blur. I don't know who that was, because the part of my spatial cortex that was damaged is memory and spatial relationships. So cognitively, I couldn't remember. The interesting thing is martial artists. We spent a lot of time with each other. I remembered your face, for sure. You know, other people I've trained with. But when it came to relatives that I haven't seen for more than 6 months, there's nothing. I couldn't put a face on it. And apparently my wife, I needed time for her to talk to me before I understood who she was. So the exercises got me back a little bit. You know, who's this dojo? Remember who was there? And I do the students that were there, and it's amazing how I remember them. But we saw each other 3 times a week. And relatives I haven't seen in a while, nothing.
What about walking? What about your back? Did you feel anything? Did you feel off in terms of back pain or anything?
No back pain, no back pain. There was no. The funny thing is there was very little pain and there was range of motion. So it threw the doctors off. Oh, look at that. But if you did this, like a child.
Welcome back. We apologize for the fact that if you're viewing this video, that we were filming outside, and what happened was, you know, we have no control of the weather, and it started to rain. Might be just a bunch of blessings, but we're grateful for that to happen. Again, I'm sitting here with Mr. Michael Santoro. I'm Master Quinones from the system of Yi Chuan, which we'll get into a bit later. and how that affected and continues to affect Mr. Santoro's rehab. I want to go back, and if it's okay with you, to touch on a little bit about what was happening with memory. And also, you had also mentioned that, where you were having difficulty in recognizing your wife. Now, before we continue, can you, if anything, did you feel that it was a short-term memory that was taking place, or do you have any recollection of long-term memory?
I couldn't differentiate between the two, to be honest with you, Sifu. Not knowing your wife's face has a profound effect on you, where you're at, your function, how you function, but also there's an emotional component. I mean, this is the person you spend most of the time with. That sort of throws you for a loop. So there's two things going on. Yeah, I can't recognize my wife right away. The functional component of it. What's that about? And then there's, whoa.
Who did you think she was?
I had to really look at her. She's beautiful, my wife, so she was still beautiful in my not recognizing her, who she was specifically. There's no thought process. You're just looking and staring. I've had that happen to me with my patients. I see them every day, and then the next day I see them. They're looking to see who I am. After they get who I am, they remember my name is Michael, all this other stuff. With my wife, once she started talking to me, I knew who she was.
Right. So I was just saying that a lot of anxiety. Did depression come in at any given point?
Depression, anxiety is huge. Number one, I'm a martial artist. And I like being able to move my body. As you know, I trained with you. Not being able to get out of bed and go for a walk.
Right.
For 5 days, I was just in the bed.
Right.
I didn't do anything. 24 hours in the bed, bed alarms on. Sometimes I told you I'd shut them off and do exercises next to the bed. But to be confined to a bed with the bed rails up for 5 days is tough. That's a whole mental thing you have to deal with. A lot of it, even the physical stuff, is mental. Can I do this? Can I do that? With not being able to recognize your wife, not being able to get out of bed, anxiety from the stroke, will I get another one? Depression, I'm not the same guy. What will I be able to do out in the world? How will I go back to work? How will I be able to feed my family? That kind of stuff. And yeah, I was anxious and depressed.
Oh yeah, that is something that has to be just totally devastating. Because you so incapacitated and you're relying on someone else to help you.
Now the depression plays into the rehab because it plays into everything, right? In your life. So certainly it would play into the rehab, whether I can walk down the hall, my motivation, whether I can do the things I need to do to get my strength back so I can move this leg properly and walk.
So you went to the rehab hospital at that
Yes,
point.
I was at Berg for 6 weeks, inpatient, outpatient. They were great. And the exercises, since I'm a doctor of physical therapy myself, I knew basically what they were, but they facilitate you in a great way over there to get things done.
Well, that's interesting you're saying that because of the fact that you are a doctor in physical therapy along with all your other credentials, and yet you have memory of that in terms of dealing with patients. So where there was a lapse of recognition from what you're saying, I'm understanding, but yet there was the part of you that knew certain, physical therapy that you were applying to those patients that you dealt with, and now here you are being a patient yourself. Is that correct?
Yes, that's an interesting transition from treating patients who have strokes, and you can even get more specific on the right side of the brain, right posterior side of the brain. You can only guess as to what they're going through, really, right? You put them in front of a mirror and say, oh, wow, they can't do this, they can't do that. Then you experience it yourself. It gives you a deeper understanding of the frustrations, of the emotions, depression, anxiety, of the whole picture, of the whole patient, of the whole person, rather than functional. They can't do this, they could do this. They can't do that, they can't do this. Why? But now I understand so much more. How the mirror plays into everything.
Fascinating.
Yeah.
And yet, with all the negative things that have been spoken about, there is a positive side in what you're saying also, because there's the compassionate side that only one can acquire by actually being now someone that is experiencing it, right? You're no longer on the outside, you're in the inside.
Exactly. I'll never go in a room and say, come on, let's get out of bed.
Right.
Yeah.
Right. Yeah. It's a deep insight. And of course, with this virus and everything that's going on globally, people, doctors, therapists, everyone is trying to figure out how do we handle this.
Yes.
So I don't think that they yet, I mean, and please correct me, that there's like an exact method or methodology that's being used here, right? It's just working and trying to bring in physical therapy in a way that's written by a doctor in terms of what's the protocol. And is that protocol based on what? You know, on previous experiences of dealing with people that have had a stroke, and they're trying to now formulate this thing so that they will go through the protocol that the past. And yet we're dealing with something that's current. Now, if we go into the ancient way of how those in the Eastern world had dealt with things, now we bring in the subject of dealing with internal arts, you know, meditation, qigong, contemplation, focus. How does concentration, contemplation, and meditation play a factor in the rehab of the person and on their cognitive way of seeing things?
Excellent question. So with qigong, there's meditation built into the exercise. Someone who had a stroke sent me these meditation tapes where the guy talks like this and says, listen to my voice. I almost had an anxiety. I almost ran out of the room. He provoked more anxiety in me than anything else. With qigong, it's built in. It's the cream of the crop. It's just given to you in the exercise itself.
Right.
So it strengthened my quads, which were weak. Visual field, I had a little bit of a neglect. If I'm doing certain qigong exercise, my visual field expands. My legs strengthen. And I'm meditating.
So for the audience itself that's watching this and wondering what is this term, Yi Chuan? Yi meaning mind or consciousness, Chuan meaning boxing, like Tai Chi Chuan and different martial arts like Bakwa Chuan, Xing Yi Chuan. For those that are familiar with that, but keeping it at a level that we can all just understand it in a very simplistic way, yet it's extremely profound. The masters of the past felt that by doing form, as many people today practice different types of form. I enjoy doing forms from different systems, but in order to develop the root, what is referred to as my teacher taught me, Master Don, the root, like a tree has roots. The deeper the roots, the stronger the tree is. So that root could only be acquired by the use of the mind, by certain postures and visualizations that correspond to that. There's also walking. There's also a way of sound and different ways of enhancing, supplementing the standing, also a seated portion, and also while you're lying down. So this method is not just strictly standing. It also has the other components where you will have seated on a chair, not legs crossed, so a very comfortable way. Also lying down. And yet the visualizations have to correspond with that as the individual goes through a process of growth and development with it. So there is a work in progress that's going on. It's not difficult, but it requires an individual to be consistent with it, and through that consistency they develop the conviction of how they can acquire this type of healing, method. Would you agree, sir?
Mm-hmm. Yes, for sure. Simple, each one is, and rewarding at the same time. You don't have to look back and say, hey, I walk 100 feet. The rewards are happening as you do it. That's my experience for it.
Mm-hmm. So we have people that are older that cannot move very fast. We don't want them to be, by trying to remember many different movements. There is certain movements that we do in the beginning simply to allow the body to enter into a state of quietude, a way of detoxifying the body. And this again, going back to the ancient way of training. And then with that, there's different postures, whether standing, seated, I said, or lying down, with visualizations that correspond. So as the individual gets stronger, these things will happen. There's different phenomena or metamorphosis that happens through the process of it. And so it's not something that is so mystical and so far out, but it is within dealing with what the Chinese masters refer to as qi, or this intrinsic energy that we have. The Japanese call it ki. In Hinduism, it could be breath, prana. It's the same force. It's not, today in the Western world, there's no way of gauging it through the systems that are available. But the Western world has become quite acquainted with acupuncture. So where are these needles being inserted? On a pathway. It's like going through a subway system, and there are different stations. And by inserting these needles in those stations, then it will create a free flow of one's qi or energy. And this again may seem quite technical, and it's not necessary to go through a whole thing of that aspect of it, but just to know that it correlates, it's there for it. Now bringing it back to what our purpose of it is what you encountered and how this can benefit others. So what I would like to do, with your permission, is to go through a little bit of the standing meditation movements and how it could be followed, the corrections, and individuals can go with that.
Sure.
Okay? All right. So we'll pause here for a moment as we move on to the next phase of it.
Absolutely.
Okay, so in this initial movement that Michael is doing, I'm just going to make a slight adjustment here. Don't bend your knees, hands are straight, and just slightly forward. So what I did here, he was kind of leaning back too much. And so I made the adjustment by having him just be straight. This way his back is straight, his feet are perfectly straight, shoulder width apart, and his knees are not bent. This exercise is good for the heart. You find many places the Chinese people practice is just rocking their hands up and down. So it's a form of detoxifying, relaxing, and it's just a simple way of bringing the arms up and down. Usually the numbers that we use are could be anywhere from 15 to 20 repetitions. Now we want the practitioner to also pick a point slightly above eye level, so he's not looking down. Sometimes we have a tendency as we look down, we might get a little lightheaded or dizzy. The lips should be slightly separated, and you should breathe naturally. Try not to coordinate the breathing with your hands. It's just a simple, natural breath of just rocking the hands up and down. And for the purposes of this video, we're only going to do 10 repetitions of everything. Moving on to the second movement, the hands are on the side. He crosses the wrists and he continues to draw his hands up about eye level, not too high, or shoulder width, shoulder level, and down. As the arms are descending, there is a slight, if possible, a slight bend. But we don't want to tilt back, so the body still maintains itself straight. There is no tilting in this way, but maintaining the angle. So it's a slight bend. And as he crosses, it's a little bend here. As his arms begin to raise up, at this point, he is standing straight up and the knees are not bent. Relax. Try to bring your awareness to the palms of your hands. A slight bend. We continue to move to the next movement, where it's just like if you were raising a balloon up and down. And at this exercise, at this part of it, the knees are not bent. Just straight, good, back straight. Again, try to just breathe naturally, and there's no coordinating the breath to the hand movements. The space between the fingers should be approximately 6 inches apart, so they're never touching. So a circular motion, and it's just gently up and down. Now, depending on the practitioner's time availability, one can do anywhere between 10 to 20 repetitions of any of these movements. So it's just gently up and down. And the next movement will be followed by, as the hands go up, very similar, except that he opens up. The knees are not bent, making a circular motion. Again, bringing your awareness to the palms of your hands and allowing yourself to relax. The body itself, the vessel itself, knows its own perfection, its own state. So what we want to do, basically, by doing these movements is to allow ourselves to enter into a state of quietude with it. There would be various thoughts coming in, concepts may arise. There's no need to try to force them away, but to allow yourself just to feel. In this world, we're so distracted by the amount of information that's coming in, and we never take time to just appreciate these moments of tranquility. These movements allow that to happen, and for the body, again, to recognize that perfect state. Again, 20 repetitions, if possible. The hands come up very similar to the movement when you were just raising the balloon up and down to just opening up, and there's no bending of the knees. Again, palms are facing out and just to feel. Okay, so this movement we refer to as a swimming type of movement, as though one visualizes themselves being in a body of water. It could be a pool, lake. The feet are touching the bottom. And if you're in a lake, you're allowing the current of the water to move the body forward and back. Just very relaxed. So there'll be a little bit of a weight distribution here, but not too far. Don't go too far. It's kind of a 60-40 split. So when you're going back, you try not to lean back and allowing the leg to just feel the weight for the moment, and then out. Relaxing the palms of your hands, drawing in. Again, in these movements, you do not coordinate the breathing, any of the breath, to the movements. Just natural breath, natural movement. So if someone finds it difficult to do this post the COVID virus and now in the recovery part of it, you can do it where you're not really bending your knees so much. It could also be done while seated. Allowing the body just to feel. Do 10 repetitions. Don't do too many, and then gradually you'll go on to the next one. So in the next, all he's doing, what he worked one side, now he's going to work the other side. So Mike, you'll be over here, and Michael Santoro will be on the other side. And it's the same repetition, same movement. Again, just an easy flow of drawing in the water and going out. So there's a saying in the old ancient way that if you want to move fast, whether walking fast, moving fast, you must go slow. By going slow, we reintegrate the body of its perfect state, allowing our breathing, our movements, our heart to benefit from this and the 5 elements. That would be, of course, your heart, your lungs, stomach and spleen as one, the liver, the kidneys. These are just a few exercises that we do in terms of the meditational part and for rehab in terms of bringing the body back to that state of awareness. It's not just the physical part of it, but also the psychological aspect that you're dealing with, and how the greater the strength of energy that's moving and flowing through your body, the stronger the mind becomes, and also in dealing with the anxiety and depression that seems to follow with this type of virus and while you're going through it. When we're done, we draw our legs back to the center. Beginning with the palms out and then drawing them back in. It's good to practice this by visualizing that there is a small gate approximately 2 to 3 inches below your navel. And the gate opens and closes with the movements of your hands. The gate opens and gently closes with the movements of your hands. One can do about 7 repetitions of this. And then at the end, just allowing the hands to come straight down by the seam of one's trousers without touching, just relax. If possible, one can bend their knees slightly. If it hurts them or it doesn't feel comfortable enough, then one should do it, one should be just straight. At this point, if you can do it, the back is straight, as though you're sitting in a high chair. Hands should be loose. Even though the eyes are closed, try not to look down. Separate the lips and breathe naturally. The normal breath. Visualize yourself being under a shower or a waterfall. Feel the water gently striking you on the crown of your head. And as the water moves down from the crown of your head, onward, down, you will feel the water gently down your shoulders, the shoulder blades, your chest, going down your arms, fingertips, all the way down, 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 down to the legs, to the feet. A continuous flow of water, letting go. Letting go of your attachments, of the anxieties. Thoughts will come and go. We remind ourselves that we have this perfect vessel, that it can correct itself, that the mechanism and all the possibilities are within it if we trust and let go. To just simply allow oneself to let go. To feel. To just simply feel. So if possible, one should have a chair directly behind them, so when they finish doing the standing meditation, they'll gently just sit. So as one can see, his hands are just by his thighs, fingers are close to the knees, his feet are perfectly straight, back is straight, lips are slightly separated so he can breathe naturally, and the eyes are closed. So even though his eyes are closed, he should not be trying to look down, which would then cause the neck to go forward, downward. We want to keep it where it's straight. So he continues the visualization of the water gently striking on the crown of the head, moving down his body, all the way down as a flow, down to his feet. Thoughts will come and go. Just plant the seed for a few seconds and allow yourself to feel the gentle water striking down from the crown of your head all the way down your body. Allowing yourself to heal, to reconnect. When we're doing these exercises and we're doing this meditation, one should remind themselves that this is their time. Not the world's time, not the job's time, not the family's time. Your time. To reconnect, to appreciate, to be humble, to have that sincere gratitude of this gift called life, and how perfect you are in every way. As Mike slowly comes to the end of his exercises, he will slowly open up his eyes, bringing his hands together, his palms, and he will rub them 9 times, slowly. Once he's done that, you could take off your glasses for a moment, and I'll hold them. And then at this point, he would put his hands together as he finished rubbing them 9 times, following Mike. And then he would draw them, go over and around and back over your face, going up, like giving himself a dress over, right? 9 times. So it's good to touch the face and allow all the meridians and everything there. Just massage the face gently, and it's done 9 times. Once that's done, he will then come over and around and place his hands over, covering his ears, cup them, and just gently tap at the base of the skull 9 times. Just gently, so if you feel any lightheadedness because of the energy might be near the head, it just draws it down. Once you've done that, you can bring the arms down and just gently massage once each side and the other side, down the chest, down, just gently to the back, the legs. And you can stop and just sit there for a moment. Try not to get up right away. So you can allow yourself to just get acclimated to the fact that you finish the meditation before you start interacting with the rest of the world. It's important that you take time for yourself. So these type of exercises and movements and meditation do not conflict with the type of rehab that is being prescribed by the doctor in terms of the protocol. We follow their instructions, and we're not offering anything that is counter to what they're saying. All we're saying is we're bringing something else along with it to bring in that state of tranquility and peacefulness. And that's it. Thank you.
So we've now moved outside, and here we have Master Quinones instructing Mr. Santoro with the walking technique to reintegrate the left leg and to build strength. So starting on the heel and rolling onto the ball of the foot. So the heel makes contact with the ground first and roll onto the ball of the foot. Just to get used to the sensation again of walking that frankly most of us take for granted. So the heel touches first and then slowly roll onto the ball of the foot before bringing up the next step. The heel roll. Here we are on the second episode. So turning the foot out slightly, about 45 degrees, putting the foot down, step through. Now bringing the weight back onto the rear leg, stepping out with the forward leg, and then step through. Now bring the weight back again onto the rear leg, turn the foot out and step through. So the weight is constantly moving from the front leg to the back leg to the front leg and step. Here's the third pass. Bringing the weight back onto the rear leg, opening up the front foot, dropping it and step through. Now we can see already Mr. Santoro's steps are a lot more confident and a lot smoother. The weight comes to the back, turn the foot out, step through. Bring the weight back again to the rear leg and step through. Here we go with the fourth run. Being conscious of where the weight is on which leg and step. Now I can see that Mr. Santoro's steps are a lot more confident and a lot more precise. The weight's being transferred. Vast improvement.